A quick update before we wrap up for the season. I'll be taking the summer off from the podcast to soak up some time with my family and enjoy a slower pace for a few months. Thank you for listening and supporting the show. It truly means so much. We'll be back in September with new episodes, expert guests, and practical conversations to help you feel stronger and more confident through pregnancy, postpartum, and motherhood. Until then, have an amazing summer. Welcome to Every Mom is an Athlete, the podcast where we believe motherhood is inherently athletic. From lifting car seats to chasing toddlers, your daily life is a workout. I'm Dr. Carly, pregnancy and postpartum expert, sports chiropractor, strength coach, and mom of 3. This is your space for strength, recovery, and real talk in pregnancy, postpartum, and motherhood. Welcome, Strong Moms. You're in the right place. Hello, Strong Moms, and welcome back. Today, we are doing an Ask Me Anything. I'm answering some of the most common questions I get about pregnancy and fitness, both in my clinic and online when people reach out to me. And truly, a lot of the advice pregnant women are getting is still outdated. I'm super grateful for social media. Well, I'm not for a lot of reasons, but I am grateful for it because I do feel like more women are getting better information, but there still are a lot of myths out there that are just perpetuated. So we're going to go over a few of those today. And before we get started, if you want to know more about pregnancy during exercise, I'm going to link the episode below with PhD researcher Dr. Margie Davenport. I interviewed her a few weeks back, and it was so interesting because she has all this research on pregnant women and how they should exercise and what is the best option and just how to keep yourself healthy and all the benefits of exercise. So go ahead and check out that episode after you're done with this one. So first question I still get is it true that you shouldn't let your heart rate get above 140 during pregnancy? And if you are an active, fit, pregnant woman, you know that your heart rate can hit 140 without even breaking a sweat. Like you could be jogging out to the car and bam, 140. So this is outdated. This is not a number that we use at all anymore. It's a decades-old recommendation, and I think it just came out as a guideline before there was better research around this. But ACOG no longer recommends this strict heart rate cap during pregnancy. The recommendation is the talk test, okay? So the way that I use this with my patients is a little bit lenient because I do have a lot of patients in my office that want to work out really hard during pregnancy. So a couple things. You want to be able to speak in full sentences. Now, that doesn't mean that you are speaking perfectly like this in complete sentences without any breaks, without any deep breaths. I always recommend okay, if you're talking, you're okay, hey, how's it going? Yeah, this is pretty tough. Yeah, but I'm doing good. You're breathing hard. Sorry, you had to hear me breathing so hard into the microphone. But that is a way that okay, I can still breathe, I can still talk, but I am working hard. I am pushing myself. I always like to remind my patients that if you can't breathe, baby can't breathe. And so you don't want to be redlining to the point where you are gasping for air. If you do CrossFit, if you do these hard, intense HIIT workouts, you know what that means. You know what that feels like. You don't want to hit that point during your pregnancy necessarily, but you can get pretty close and still be safe and still be within a reasonable range. And again, this is going to be different for everyone, right? Someone who has not been working out much, who's maybe been walking, but not doing much else, you're going to be breathing a lot harder if you jump into, say, you want to start Orange Theory or you go to a HIIT class. Your breathing rate is going to increase quicker than someone who has been training at a high level for a long time. So it's different for each person. That's why I think the talk test is a really good way to guide what you're doing. Now, remember, the recommendations for all Americans, including pregnant women, is 150 minutes of moderate exercise weekly. So I like to recommend we split that up, 30 minutes, 5 days a week. But actually, when I had that conversation with Dr. Davenport, she elaborated on the Canadian guidelines, and that is that every little bit of exercise counts. So even if you're going for a 5-minute walk, you walk your kids to school and that's 20 minutes. And then you do, let's say, a few minutes of squats in your kitchen while you're making dinner. Well, now maybe you've accumulated 30 minutes and it's not in that 30-minute chunk. So every little bit of exercise counts. That's another way to look at it. And that's just a good way for us to stay active and stay moving. Now, this question often leads into questions about core because pregnant women have heard online how important core work is during pregnancy. If you have followed me for any amount of time, you know that I am obsessed with core work during pregnancy. It is the way that I had my best recovery in my third pregnancy at almost 40 years old. I just didn't have the time to do all the intense exercise and CrossFit and weightlifting and all the stuff I was doing in my other two pregnancies, which I loved, but I just didn't have the time. And honestly, I didn't have the energy. And so what I did was focus on core work. I focused on getting some walks in, getting a couple of workouts a week. And then on those other days, just making sure that I was doing my 5 to 10 minutes of pregnancy specific core work. And what I mean by pregnancy specific is that it is helping you train the muscles that are going to help push the baby out, that are going to help you recover postpartum. It's just like when I have patients in my office who are going to have knee surgery, let's say. We don't just send them into knee surgery like totally deconditioned. I have them keep working on the knee exercises, the hip stability, all the stuff that's going to strengthen both that knee and their other side before they go into the surgery, because then when they come out, they're going to recover faster. That's proven, okay? And it's the same with pregnancy. If you go in a better condition, if your abs and your core and your deep core muscles are working to support you, support your spine, not only are you going to have less back pain, but you're going to recover quicker. Okay, I'll get off my soapbox here in a minute, but that's exactly why I created Prego Core, right? So if you're pregnant and you're looking for that core program that is not too over the top, isn't like 20, 30 minutes a day, isn't the whole thing, my Prego Core plan is 5 to 10 minutes. So definitely check that out. You'll see the link below. Okay, this is one that I talked with actually 2 women this week about, and I posted online about this as well, but exercise during pregnancy can actually help reduce labor complications and C-section risk. And this is a question I get from women about C-sections. Now, of course, just because you exercise does not mean that you're not going to have a C-section, okay? Do not hear me wrong here. But multiple studies have shown that exercise during pregnancy is associated with lower rates of gestational diabetes, lower rates of excessive pregnancy weight gain, lower rates of pregnancy-related high blood pressure. And some research also shows that physically active women actually have lower rates of C-section delivery, shorter labor durations, and improved postpartum recovery, which, I think we all kind of know that. Okay, now concerning C-section rates specifically, research has shown that women who exercise during their pregnancy are less likely to have a C-section compared to women who remain inactive. And most studies show this is about 13 to 15%. Some studies, newer studies actually, one as recently as 2025 shows it as high as 34%. So we cannot guarantee a vaginal delivery for any workout program at all, right? And there's plenty of women that are still going to need a C-section for many, many reasons. But I think this is just good information to have to encourage you that working out during your pregnancy is not only safe, but is beneficial. The third question I get in my office often and online is about pubic bone pain or pelvic girdle pain, and if it's common, especially, or normal during workouts. So I will say that it is common. That doesn't mean it's normal, and it definitely doesn't mean you should ignore it. And so there's a few things that I see in my practice that I make recommendations to women to either modify or eliminate for the time being. And again, this doesn't mean you have to stop them forever. It even could be week to week. The body changes so much during pregnancy that maybe, week 28, this is feeling horrible. We have you stop it. And maybe you try it again in week 30 and, it feels fine now. It just, as the baby moves, your body is shifting, everything is just different by week to week. I always tell my patients, like, if you came in for a shoulder injury, I'd be able to say, okay, here's what's wrong. Here's what we're going to do. Here's your game plan. Here's your exercises. We're going to modify these in a couple weeks and then a couple more weeks. And by 6 weeks, you should be pretty good to go. Like, I can make a very succinct game plan. During pregnancy, I cannot make that plan because literally every week you have a new body. And so when I'm working with pregnant women, we're basically trying to keep you active, keep you doing the things that you want to do. And that might mean that we change what you're able to do week to week. So all that to say that some of the things I see that can really irritate the pelvis, the first one would be single leg work. And this one is because you have so much additional weight in your pelvis. And when you go onto one leg, that one leg is supporting your entire pelvis and all the weight of your body. And sometimes our bodies are just not able to do that. We have to remember we also have relaxin in our system, and that's going to make all the ligaments and everything, the joints and everything looser. So if you're having a lot of pubic bone pain, especially with certain exercises, like sometimes I see it with lunges, with single leg deadlifts, with like lateral lunges, or even box step-ups, I often will have women eliminate that for a little while and just focus more on exercises that use both legs planted on the floor, because that's going to help engage both sides of the pelvis, and then you can have both legs and hips for support. The other thing, of course, I recommend is to see a Webster certified chiropractor. If you haven't, one thing that can be happening if you have pelvic pain or pubic bone pain is that your pelvis can be rotated just a little bit, right? Our two hip bones move individually. So if you reach back and feel those like the little dimples on your back and then like right around through your hips, each one of those big hip bones, they move independently. And so what can happen is one can get rotated forward a little bit for all kinds of reasons, right? Maybe it's the way you sleep, maybe it's the way you sit, especially if you sit with your legs crossed. Please stop doing that, especially during pregnancy. Maybe it's from like a little slip or an exercise or whatever it is. Remember, it's so much easier for the pelvis to move in a good way and a bad way during pregnancy. And so one can get rotated forward a little, one gets rotated back. And so then you have this little twist in your pelvis, and that can put a lot of additional strain on one side. And so if you can get in to see a Webster certified chiropractor, if there's not one near you, you can also see a pelvic floor PT can help you with this often. Sometimes even massage, like a prenatal massage can help with this. But usually I like to have the actual joints moved, which you need to see a chiropractor or a PT for that. That can actually help alleviate that pain a lot. And then the important thing is you need to make sure that you have exercises either from your chiropractor or like from my core plan or from my pelvic pain plan or something to help you keep the hips in that position, right? Because again, it moves so easily. So we want to get it moving in a good position, and then we want to stabilize it in that position. The other thing I want to mention about this is that lots of times stretching will make this worse. Okay. So if your pubic bone is hurting, if your pelvis is hurting, I don't usually recommend stretching because what will happen is that you kind of pull on the muscles in the area that they don't really need to be pulled on. Like the part that's stuck or feeling tight, that's not the part that's going to release, right? When you stretch. That part is going to stay stuck, and then the part that's already mobile is just going to stretch more. And so I usually recommend foam rolling. You can get up into your adductors or those inner thigh muscles. You can really get up in there and release some of that. You can release through your glutes will often help. You can roll along the front of your thighs. All of these you can do during pregnancy safely, and it can help alleviate a lot of that pulling and pain. So I just like my pregnant patients to think about it like, yes, if you're having pain, it might feel good in the moment to stretch, but usually what you need is more stability. You don't need more mobility, or at least you don't need more mobility like all around, maybe in certain areas. So try the foam rolling. Ideally, you can get into a provider that can help you with this. But if you can't, I do have a whole plan that helps you through this at home for pelvic girdle pain, pubic bone pain, sciatica, round ligament pain, low back pain, all these things, and just walks you through step by step how to actually reset your pelvis at home and then to restabilize with some exercises. Okay, finally, this one is huge. What exercises should I avoid in each trimester? So I want to say there's no universal bad exercise during pregnancy, okay? Everything is individualized. I don't usually have my patients modify very much at all in the first trimester as far as activity goes. Now, they're going to modify things because they feel horrible or they have no energy or they're sick or whatever reason that is. And I just really want people to give themselves a lot of grace around that. I think a lot of people think because I was so active through my pregnancies that I like felt great and was like working out and moving every day. But my first trimester in my second and third pregnancy was pretty rough, like real rough. My first one, I don't know, it was a fluke and I felt great. And then it was like payback in my second and third for how great I feel. But I was like just eating crackers and cereal and resting. I could not do much in that first trimester. So if that's you, please, please, please don't beat yourself up. Give yourself some grace and just know that like, hopefully the second trimester is going to roll around and you're going to feel a lot better. Now, once that second trimester rolls around, that is where I have a lot of my patients start doing some modifications. Now, some women have heard that you can't be on your back during pregnancy, especially after that 20-week mark when the baby is theoretically big enough to compress your vena cava and the vessels that are going back to your heart. But as long as you feel, if you lay on your back and you feel fine, you don't feel dizzy or nauseous or sick or anything like that, then generally it's okay. If you feel those things, then get off your back. That means that maybe your baby is in a position that it is compressing some of that stuff, but your body will for sure tell you. So if you don't feel those things, you can be on your back for things like glute bridges, dead bugs, whatever kind of exercises you want to do. Totally fine. Totally fine, generally speaking. Obviously, if you have special complications, speak with your doctor. But generally speaking, if you're not having any of those symptoms, it's okay to be on your back. Now, you might want to also modify things that are a high risk for fall, right? Like, so maybe if you're rope climbing, maybe you stop doing that. Maybe rock climbing, maybe you stop doing that. But again, each person is different. You have to make these calls for yourself. For me, I stopped running about probably around like the 20-week mark for sure in all of my pregnancies. And that's what I see pretty commonly with a lot of the patients in my office. And I've definitely had patients run all the way through their pregnancy. But I think we think it's more common than it is because you see on social media women doing this. But I think the women that you see are these high level elite runners. Generally, a lot of women are not running all the way through their pregnancy, in my experience. A lot of them, we have them switch to hill walking because you can really work your glutes, which is going to help your pelvic floor. You can get your heart rate up and you still get those effects. And so I really like hill walking for that. I love sled pushes and pulls if you can do that, because again, you're really engaging your core, your deep core, and also getting your heart rate up, getting that cardio. So I love that too. And then I have my patients start modifying 4 exercises that cause coning and doming. Now, you can find people that are on both sides of the spectrum. You can find people that say it doesn't matter, coning and doming is fine, it doesn't hurt the baby, it doesn't hurt you, which is obviously fine. But in my opinion, in my practice, I work with a lot of women that want to get back to a really high level of fitness postpartum. And here's the thing. Why would you do something that could potentially make it harder for you to recover later when you could just not do it, right? When there's so many other things, better things you could do. For example, crunches, maybe toes to bar, planks. Sometimes women have coning or doming with planks. So there are a lot of other core exercises that are effective, that can work your deep core without causing that pressure leak out through the front. So I do have my patients modify for that. I modified for all of mine, all of my pregnancies, and had a really great outcome. And I've seen it over the past 15 years. I've seen a lot of other women have really great outcomes and be able to get back to that activities and fitness and high levels of athletics that they love. And I attribute part of that to just being a little more cautious during pregnancy. And I think that's totally fine. But like I said, you'll find people on both spectrums, right? People that are like, don't let coning happen at all. It's the worst. Then you'll find people who say it's fine. Research shows that it doesn't affect anything. Okay, well, I land somewhere in the middle where we modify some things. And then we also don't freak out about it. Like if you end up sitting up in bed, rolling over, like whatever it is, and you see that coning, which by the way, just to be clear, so we're all on the same page, coning and doming is if you were to look down at your abs and you do like a little crunch and you see how it kind of like pushes out almost like into a triangle or a little bulge, that is coning or doming. What's happening? It's just like a pressure leak, okay? Because you have this line down the middle of your abs, like that 6-pack of abs, right? Right down the middle, there's that line. And that line of fascia, which is this connective tissue, it starts to stretch during pregnancy. It has to, right? Like where's the baby going to go? So it stretches. But then what happens is because of the stretch, your abs, your deep core muscles are not able to kind of control the pressure. So with certain movements, heavy overhead pressing, like I said, any kind of crunching movement, sometimes planks, that is where the pressure kind of leaks out through. And it just puts a little more pressure through that area, which can be a little bit harder later to recover. So, okay, I'll get off the soapbox. I recommend avoiding coning and doming basically beginning in that second trimester. Oh my gosh. Okay. This episode is getting so much longer than I meant for it to be. But real quick, third trimester. Okay. Third trimester, we're really focusing on stability. We're focusing on birth prep. We're focusing on mobility of the hips. So stability of the pelvis, but mobility of the hips. I know it's a little bit confusing, but remember, when you're giving birth, you're basically in a squat position, whether you're squatting or not, right? Even if you're on your back, which arguably is not the best way anatomically to give birth. But even if you're on your back, I was on my back for my first son, you're in a squat position, right? Your legs are up in that squat position. So you need to be comfortable in that position. Often in the third trimester, we're modifying jumping just because it's not comfortable. It doesn't feel great on your pelvic floor. We're probably not max lifting anymore, right? So I generally have my patients keep it around the 80% mark, I think is fine, just depending on the patient, on the person, and what they've been doing before pregnancy. And then again, really focusing on core, focusing on birth prep so that we are doing things that actually help us get the baby out and then recover postpartum. So if you're pregnant and trying to stay active, but feeling overwhelmed by all this different online advice that you can get, that's exactly why I created PreggoCore. It's a doctor-designed, by me, obviously, pregnancy program that helps you strengthen your core, reduce common pregnancy aches and pains, and safely modify workouts through each trimester. So basically what I wanted to give you is something you can do easily at home with very minimal equipment, and you can still feel like you're prepping towards healing postpartum, having a good labor, and also decreasing pain. I love doing these episodes, but obviously I like to talk too much and they get a little long-winded. So if you have a question that you would love for me to address, I would love to hear it. So you can drop that to me in a DM on Instagram. I am arguably on there way too much, but drop me a DM at Dr. Carly and I will try to get an answer on the show. Okay, until next time, Strong Moms, I am so grateful for you. If you're pregnant, just know that you can keep working out. You should keep working out, but at the same time, give yourself some grace. You are so strong and so incredible, and I am so glad you're here. All right, until next week. Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder that you're still the athlete you've always been. If this episode resonated with you, I'd so appreciate it if you'd share with a friend or leave a quick review. It helps more moms find the support and information they need. See you next time.